Good morning. Yep, still morning. Everyone, my name is Adam VanDeusen, as Rosie said. I'm in industrial and operations engineering. I really love thinking about how we can make our healthcare system better using operations research and other mathematical tools. I'm going to talk to you a little bit about some examples of that this morning. So imagine you are walking down the street and you see this image. It's a little bit fuzzy, but you can make out what things are. You see a stop sign, a bike, people walking. But if you have eye disease like glaucoma, you might see something more like this. Pretty fuzzy. You can kind of still make out objects, but it's a lot tougher. Now imagine that you are a veteran living down there in Georgia, that's around Savannah, and you want to get access to eye care. But within the VA system, your options for getting eye care are pretty far away. So depending on how willing you are to go get that care, it might be pretty tough. So let's say you're trying to get to your eye care appointment, except you do have glaucoma as well, so you have a little bit fuzzier of a picture. So driving to an eye care appointment that's very far away might be pretty challenging. Additionally, you might have some challenges getting into an appointment because your provider, your healthcare provider, is really overbooked with patients and isn't able to see you until like 3 months later. Or maybe you don't have a car and aren't able to actually drive to the location you need to get to. All these different barriers can add up, and you may end up deferring care, and your disease can progress to the point of blindness. We don't want that to happen. So I work with the VA, specifically the VA in Georgia, to look at how we can add different options for providing eye care to the population there. In particular, we look at adding highly trained laboratory technicians to primary care locations. So going to see a primary care provider and having an eye appointment during that visit. So if you're that veteran living down in Georgia, maybe there's a primary care location very close to your house. That makes it much easier to get to and helps to eliminate some of those barriers to care. So we have our primary care visit. We're adding in the laboratory technicians doing eye screenings and other eye care at that visit. And we want to understand what are the system level impacts to the VA as far as costs and burden on providers. And also, what are the implications for patients? Are they able to access care in a more efficient manner? Are they able to save money? And do they have better clinical outcomes? Can we prevent that blindness from occurring? So before I get into how I use operations research specifically for this topic, I want to tell you a little bit more about what operations research is. So operations research, or OR, is basically a way of looking at complex systems and problems. We use a lot of creative thinking and mathematical models and analyze a lot of data to try to create these different solutions. Usually that involves decision making around how to improve the efficiency of a system or how to improve the value in a system. OR is applied in a lot of different areas, including transportation, defense, and finance. Very classically, it's applied often in manufacturing and a lot of warehouse settings. And it's really related to industrial engineering, the field that I'm in, but you can also find examples of OR in mathematics, statistics, and business. So when we're thinking about different types of how OR is applied, you can think about modeling efficient hurricane evacuation strategies. So a hurricane is coming, you need to figure out which different places need to get evacuated at which times to make sure that people get out in a safe and timely manner. You can think about allocating limited supplies of a vaccine in an epidemic. So you can figure out kind of what are those really vulnerable subpopulations, or what are the ways we can really mitigate the spreading of an epidemic by giving vaccines when you have a limited supply to the right populations. And for many of you, probably getting here today, you may have used Google Maps or some other map application or navigational system to try to get here in the best way. So with operations research, or we can figure out, we have these 50 different options of how to get from point A to point B. What's the best way to get there? So one of the common tools that we use in OR is called linear programming. And I'm going to walk through a basic example of this, and then we'll go into applying it to that eye care in Georgia veteran setting. So let's say we have an equation, and we're just trying to get the largest number of largest value of z in this equation. And to do that, we're going to choose values for x and y. So if we had no rules for this, we could just say make x infinity, makes y infinity, z is infinity. We've maximized. But in linear programming, as with most problems in life, we have some rules, some constraints. So for this one, let's just make up some rules. We'll say x plus y is less than or equal to 10. And 2y plus x has to be less than or equal to 14. And to make our lives a lot easier, we're going to say that x and y are both non-negative. Graphically, this would kind of look like two different lines on x and y axes, where that blue line is representing our first rule, our first constraint. The pink line is representing the second one. And the x and y axes represent the non-negativity constraint. Then we know that our solution to that how to maximize z is going to be some combination of the area under the first constraint line, the area under the second constraint line, and the x-axis x and y axes at the bottom. So this is going to be our feasible region, our area where we know that solution to maximize the equation where we pick x and y is going to lie somewhere in there. I won't go through exactly all the steps in how to solve this, but as a fun solution, the correct answer here is that we make x equal to 10 and y equal to 0. So we're going to do some more math. This is a little more complicated, but this is thinking about the veterans in Georgia getting to eye care. This looks really complicated. I don't want to make you do all this math while you're eating lunch, so I'll walk you through it in some simpler terms. So that first equation, that objective function, really just says we want to find the minimum cost to the system. And while we're doing that, we want to figure out where we're adding eye care, where we're adding these different laboratory technicians to primary care clinics, and which patients of our population are we assigning to each of those clinics. And just like with our simple example, we have many constraints here. For example, we don't want patients to travel more than 120 miles. That's just not going to be feasible for our veteran population. We also want to make sure that patients aren't assigned to a clinic such that the clinic is over capacity. And we also, in this rule, have a fun additional constraint that you can't assign patients to a clinic that's not open. We want to make sure everyone gets to care. And the last constraint I'm not going to get into. It's basically just making sure the model behaves. But when we solve problems like this, we can get some really powerful results. Specifically, when we start kind of at our baseline, what we currently are offering in the VA for eye care, at baseline, and compare it to just saying we want to add 3 lab techs at some of the primary care clinics throughout the state, we can see about 4,000 additional patients each year while increasing the dollars spent per patient. That does go up while we do this, but only by about $25 per patient. But we can decrease the distance that patients travel by about 25 miles. And we can decrease the distance, the maximum distance that any one patient travels from 156 to exactly 100 miles. And problems like this are really important in the US because access to care is a huge issue. So this map shows areas that are medically underserved. All the green areas are medically underserved, and this is a very green map. Green usually means good, but in this case it's actually not so great. The red and yellow are medically underserved populations, so even if the whole area isn't medically underserved, there's not enough physicians or providers for them, there are some subpopulations who can't get access to care. And when we narrow in on Michigan, where we're all from, we can see that this is a huge problem even within our own state. I grew up in St. Clair County, the kind of red area over in the edge of the thumb. And knowing that there is a medically underserved population even within my home county is pretty surprising and startling and really motivates me to continue to try to make improvements in access to care. So within OR, we can use a lot of different tools to address these barriers to access. So we can use facility location models like the one that I've been reviewing to help to make sure that there isn't a geographical barrier to care, that there's actually going to be clinics and healthcare providers close enough to patients. We can use integer programming, which is kind of a subset of the linear programming that I went over before, to work on scheduling, making sure that provider schedules are set up so that they can actually see the right amount of patients and get people through while still providing quality care. We can use some statistical models to make sure that patients have the finances to cover the cost of care, whether that's through insurance or some other financial system. And we can use some geospatial network analyses to look at logistics of care. So things like, is there a bus route that I live on that gets me to care in a timely manner? And those methods aren't directly linked to just that one barrier. We can use a combination of all those methods to address all the different barriers. So what I hope that you can take away today are a few things. First is to continue inspiring your students that math can have really powerful and meaningful applications that can make a huge difference in the world. Next is that engineering isn't just math. There is a lot of talking to people, communicating, making sure that creativity is included in solutions. So even if you're not the math all-star, you can still really contribute to this field. And lastly, the importance of interdisciplinary work. I couldn't do the work that I do without collaborations with healthcare providers, people in public health, people in public policy. And that is really important as we're making sure that folks are getting the best care possible. Finally, I wanted to leave you with a few resources here. So the first is a general repository of K-12 programs from the university. That's youthhub.umich. Camps4kids.engine.umich are engineering-specific camps that you can look into. Also, the Society of Women Engineers has a ton of options for outreach and education programs, including some where you can have students come here and some where they'll come to you in your own schools. I'm happy to answer any questions, and feel free to contact me via email or on Twitter. Thank you.